Hello, my name is Jeff Dover, and along with Dr. Mark Weisinger, we're continuing our series on lung cancer. And today's topic is the signs and symptoms of lung cancer. So, Doctor, if you will, tell us about the signs and symptoms, but before you go through them, define what a sign or a symptom is.
Well, thank you, Mr. Dover. I think that implies that there's some confusion, and I think there is about the two terms, but it's pretty straightforward. A sign is what a physician can observe during the examination of a patient. That's what a sign is. A symptom is actually what the patient complains about. They're typically grouped together simply because it's the multiplicity of both signs and symptoms and sometimes how they correlate logically that allows for a more accurate diagnosis. So that's generally about signs and symptoms. Now, the signs and symptoms of lung cancer are pretty straightforward, and they're commonly known. It includes a cough, especially one that is persistent, any kind of coughing up of blood, breathing difficulties in general, shortness of breath, wheezing, funny air sounds, little squeaks that you may hear when you breathe deeply, or a difficulty in trying to get a deep breath are very, very common. Chest pain is a possible symptom of lung cancer, but it's fairly rare. Usually by the time you actually have pain, the cancer has unfortunately manifest to a great degree. A hoarse voice is an uncommon one, but may actually suggest that you have more of a tendency for a bronchial carcinoma, an airway carcinoma, which is actually part of lung cancers. Difficulty swallowing, therefore, can be part of the same thing, and it may suggest an extension of a cancer all the way to the swallowing tube. Feeling tired all the time and weight loss are common symptoms of pretty much any cancer, but they're particularly characteristic of lung cancer. People who get lung cancer will lose a lot of weight, and they will be exhausted, partly because of the activity of the cancer itself, kind of stealing energy from you, and partly because you may have an actual impairment of airway and oxygen absorption. And so you may develop an anemia, and you may develop a low oxygen saturation in your bloodstream that makes you very, very uncomfortably fatigued.
Thank you, Doctor.